Hi everyone, Dr. Jeff back this week, and I know that Magdalene's been researching lots of topics for us, and this week we've got a real topic we haven't talked about before. We're going to talk about
dislocations.
What's a dislocation?
So a dislocation happens when your bone it leaves your socket. So it can either be a full or a partial dislocation. Partial dislocations are called subluxations.
Yep.
And they occur when it shifts in that joint capsule. A full dislocation would mean your bone is completely out of the socket.
Yeah, just falls out.
Yeah.
So a lot of the types of dislocations we see are fingers. That's number one. Volleyball, basketball, football, ball hits your finger, or you hit someone when you're trying to steal the ball or something. A lot of that we see at the office. We also see the next two biggest joints would be knees and shoulders. Other ones we dislocated. Those really require a contact sport. That's usually something that requires a lot more force. So you're looking at football, soccer, rugby, hockey, those contact sports where you're being checked into the boards, or you're being tackled to the ground, and you're falling awkwardly. Those are more of the types of sports where you're going to dislocate a shoulder or a knee.
Mm-hmm. And so how you might know you've had a dislocation is that, first of all, the joint's kind of looking funny, like maybe your arm's not pointing in the right direction.
Kind of bent sideways a little bit.
Yeah, if your finger's dislocated, it'll be pointing the wrong way. You'll also lose function in that joint. It won't work properly. You'll get some swelling as well as some bruising.
Mm-hmm. So if you dislocate a joint, please don't try and put it back yourself. That's the worst thing you can do. One thing is that, especially your bigger joints, your shoulder, your knees and stuff, you've got a bunch of arteries and veins and nerves that run through there. And one thing that can happen is that dislocation can actually impede those, so it can cut off the blood supply or cut off the nerve supply. You start to get some tingling down the arm, or your arm starts to get blue, or things like that. Finger is not so much. Fingers, here at the office, you come in with a dislocated finger, we can generally put it back in for you and stuff. But whole idea is, if you dislocate something, go see a health professional that deals with this type of stuff and get it looked at and get it assessed properly so it can get treated.
Absolutely. And so what rehab might look like if you've had a dislocation is they'll brace that joint for you and make sure it's stabilized. Eventually they'll move on to some stretching and range of motion exercises, and then some strengthening to support that joint even further.
Yeah, so generally it can take, fingers, if we relocate your finger, it can take a few weeks to kind of get better depending how badly you've done it. And I've had people come to the office and it's been years since they hurt their finger and they kind of notice it's not looking quite right, or I notice it's not looking quite right. So, oh yeah, I hurt that playing this or playing that, and I can go in and kind of relocate it, and instantaneously it kind of feels better. When it comes to knees and shoulders, again, you want to go see a professional healthcare person regarding that. I have done a couple knees and I have done a couple shoulders, but generally this is something to go to the hospital for, because afterwards we want to x-ray it to make sure we've got it back in the right spot, that it's set properly. And it can take a few weeks for a finger to a number of months, 9, 12 months for a knee or a shoulder to get better. Generally when you're done, if it stays in place for a year or two, you're probably good. Because in the first couple of years, because the ligaments have become stretched and the muscles have been weakened, you're more inclined to dislocate it after that. But if it's in for a year or two, generally you're pretty good. I've had patients that have come in and they're just rolling over in bed and they dislocate their shoulder. That's something that no matter how much exercise you're going to do, it's not going to stabilize it. This is something where they're going to have to go and surgically move the muscles around, try and stabilize the joint. This is something they don't really want to have to do, but you can't live your life with your knee or your shoulders dislocating. So you really need to go in and get that professionally taken care of with some surgery. And then again, it's just a matter of rehabbing it, as Magdalene said afterwards. But again, a lot of times after you dislocate a joint, generally we'll put you in a brace or something when you're going back to your sport, just to stabilize it and keep you happy.
Absolutely. So if you liked our video today, make sure to like and subscribe to the channel to see more videos. We'll make one every week. And as always at Goldsworthy Wellness, we got your back.